Hi, my name is Sam and I'm one of the Public Health 5 to 19 team, and today I'm going to be discussing toileting. So now we're going to talk a little bit about toilet training. So the first thing to think about is that daytime wetting is actually really common, and it affects around 1 in 75 children over the age of 5 years, and this can vary from just damp underwear or to the whole bladder emptying unexpectedly. The good news is that most children can learn to be dry, given time, a consistent plan, praise and patience. The amount of time it takes to fully toilet train a child can differ hugely from child to child. So our children are unique individuals with their own needs, and so the time it takes can vary quite a lot. Toilet training can sometimes feel hard work and quite stressful as a parent, particularly if you feel like you've tried everything and nothing is working, that you haven't seen much progress, or perhaps you have a child that was once reliably dry and you now feel like they've regressed a little bit. So we hope that by exploring toilet training and offering some tips at the end of this presentation, you'll feel more confident and positive about moving forwards. As parents, we are often told to watch for signs that our child is ready to toilet train. So you might hear people talking about things like your child being aware that they are wet or asking to be changed. They might hide or leave the room when they want to do a wee or a poo, or they might have shown an interest in the potty or the toilet. But not all children will show these signs, but that doesn't necessarily mean that they aren't ready to do it or they won't be able to do it. So what causes daytime wetting and soiling? Young children find it hard to switch their thoughts from one thing to another, particularly if they are very deeply focused in something. So it might be that they're just not getting the messages that they need to use the toilet. Sometimes it can be down to a big change in routine. So this can sometimes feel unsettling for children and can lead to a bit of a toileting regression. Events such as moving house, starting a new school or class, parental separation, or the birth of a new sibling can all feel very big for young children. If you feel there's been a big change in your child's life recently, and this might be causing them some difficult feelings, it might be best to wait until they are feeling more settled to toilet train. Constipation can often be a cause of daytime wetting and soiling, as it can put pressure onto the bladder, but we'll talk about this a little bit more on the next slide. Some drinks can also have an adverse effect on the bladder, so drinks such as tea, coffee, juices and fizzy drinks. And if you think that your child empties their bladder more after they've had one of these drinks, it might just be worth cutting it out to see if it does make a difference. Another cause can be a UTI, so sometimes a urinary tract infection can make a child wee more often, and it's often accompanied by a stinging feeling. If you think that your child might have a UTI, it can be checked really easily with a urine test at your GP. Another cause could be bladder capacity or having an overactive bladder. Some children do have a small bladder capacity, which means that their bladder holds less fluid than it should. This can be supported by ensuring your child drinks plenty of drinks throughout the day to ensure that the bladder can hold as much as it should. An overactive bladder causes a sudden and frequent need to empty the bladder. There will often be little warning that a child needs to use the toilet. Another cause could be rushing when using the toilet. So the bladder does take time to empty fully. Sometimes young children will feel like they have finished a wee and they will quickly rush away to carry on playing. But if they were to finish the wee, wait 10 seconds or stand up and try again, they might find that they haven't fully emptied their bladder. And the last one is anxiety and emotional upset. So this can't be helped and it is just a part of life, but it can cause an urge to empty the bladder more. This links in with our fight or flight stress response that is inbuilt within our bodies, and it will usually settle once the anxious or stressful event is over. Constipation can affect the bladder as shown in this diagram here. There is often a lot of pressure put onto the bladder that can cause children to wee more often. This is why it's important to check that your child isn't constipated. They should be passing stools around 4 times a week. If it's less than this, or they are too hard, then they might be constipated. Another thing to consider is that sometimes leaking poo can often mean that your child is constipated. So using the chart above, types 3 and type 4 would indicate an ideal poo, whereas numbers 1 and 2 would indicate constipation. You can help your child to avoid constipation by increasing fibre in their diet and increasing the amount of water they drink throughout the day. Here are some of the most common toileting issues that we come across. So, toilet or potty refusal. So this would be where a child refuses to use the toilet or the potty, or they might become very distressed or anxious at the thought of using the toilet or the potty. Another one that we mentioned earlier is the not sitting for long enough. Not noticing or caring that they have had an accident, so they might not tell an adult, or they might pretend that they haven't had an accident when someone approaches them. Fear and anxiety around toilet training, so discussing using the toilet or anything that relates to toilet training might cause upset or distress. Withholding or avoiding doing a poo is really common. A toilet training regression, so it might be that you have a child that has been reliably dry in the day and they've appeared to go backwards a little bit. Using nappies when starting school, or also becoming wet when we have been previously dry. Now I'm just going to talk through some top tips for toilet training. So if anything that we've talked about so far has felt familiar to you, we hope that some of the things that we're going to talk about now might help you on your journey moving forward. So tip number 1 is to make a plan. There's lots of things to consider when making a toileting or a sitting plan, but the key is to be consistent in what you decide and plan ahead where possible. The plan would need to be shared with anybody else who might be caring for your child, so this might be another parent or carer, extended family, school, or even friends. You need to think about when you're going to start the plan and stick with it. It doesn't need to be a full toileting plan, and sometimes we can call this a sitting plan. If at the end of this video you feel you and your child need some support to put a sitting plan together, we can share details of how to book an eSchool Nurse appointment with us. Tip 2, think about what you might need. So this doesn't need to be really expensive equipment, but some things you might want to consider are a few spare changes of clothes or uniform, 3 spare changes of underwear, and remember to include socks or tights in this, a bag to store everything in, flushable wipes, and a carrier bag or freezer bag for any soiled underwear. You might also want to consider any toys, games or books that might help your child to stay calm whilst they're sitting. Tip 3, environment. A calm and relaxed environment is really important, especially if you have a child who is anxious about toileting or becomes bored and doesn't sit for long enough. Some children can be easily distracted with a small book or games. Some children might like to listen to music. Blowing bubbles can also be helpful for children who are constipated or withhold. The key is to choose something that you know will work for your child. Tip 4 is to praise and reward for sitting. So use lots of praise and positivity when your child has sat on the toilet, even if this is just for short bursts initially. You can use reward sticker charts if you like, but remember to reward the sitting and not just the wee and the poo, as this will take the pressure off and encourage your child to sit again for next time. Also, when thinking about rewards, try to use non-food rewards wherever possible. So you might like to choose something like a games night or a movie night rather than rewarding with food. Tip 5. Try to avoid asking your child if they need the toilet. Instead, try saying, "It's time to sit on the toilet now." Be calm and clear. And the idea around this is that sitting on the toilet will eventually become something really routine and usual, just the same as sleeping, eating and drinking. Tip 6. Think about your child's fluid intake and diet. As we mentioned earlier, being hydrated is very important for children and can reduce the risk of both constipation and daytime wetting. The recommendation is that your child will be drinking around 6 to 8 glasses of water a day. Diet is also important. Children should be eating at least 5 portions of fruit and vegetables daily and have plenty of fibre in their diets. If you are at all concerned about your child's eating, hydration or diet, please contact your GP or come into eSchool Nurse. Tip 7. Think about timings and routines. You might want to consider what your child's daily routine will look like and how toilet access will work on these different days. Some things you might want to think about are, will there be any long journeys? What will happen at school? Do they attend any after-school clubs? Are things different on weekends? So do they stay over with friends and family, for example? Ensure that your child knows what they need to do in different situations and reassure them. If there's going to be a long time without a toilet access, try and sit before and after that time. The need for your child to use the toilet will be greatest around 20 to 30 minutes after they've eaten. So as part of their sitting routine, you might want to ask them to sit on the toilet around 20 to 30 minutes after they've eaten. Tip 8. Consider clothing. You might want to think about your child's clothing and how easily and quickly they can get their clothing on and off when they need to use the toilet. Zips and buttons can be quite tricky for younger children or with those with issues around physical and self-care skills. Tip 9. Think about sitting position. Try to elevate your child's feet if possible, as shown in this picture. Some parents find a stool quite helpful just to raise their feet slightly. Sometimes rocking slightly backward and forwards can also help, particularly if your child is constipated. Our last tip is tip number 10, using resources to support. You might want to consider any additional resources you or your child might need to help you on your journey. The ERIC website has lots of help and support available to download around toileting if you feel that you might need further support. And the link to the website for ERIC is coming up on the next slide. So if you would like any further support, these are some really great websites to try. The first one on the list is the Public Health 5 to 19 service website. We've also got a link here to ERIC, which is the Children's Bowel and Bladder Charity, Bladder and Bowel UK, and the last one on the list is the NHS website, which has a guide on potty training younger children and some really useful links. Thank you so much for taking the time out to listen to this presentation, and I hope that you found it useful. If you have worked your way through some of the top tips and you've had a look at the ERIC website and you feel like you might need some further support with regard to toileting, you can book an appointment with our eSchool Nurse video clinics. So you just need to phone the number at the bottom of this poster here, and you can book an appointment on a Tuesday or a Thursday to speak to one of our nurses.